Today we'll be talking about diuretics. Okay, so when you are managing hypertension, you cannot you cannot avoid diuretics are very important in the management of blood pressure. Why? Diuretics help to, when the patient is experiencing hypervolemia and there's so much going on, the pressure in the body is so high because the volume is too much, right? What happens is that when you administer the anti that is the diuretic medications, when you administer diuretic medications, it will reduce the volume, to reduce the blood volume, especially the plasma content of the blood will be reduced. And when that happens, the blood pressure will invariably reduce as well. Okay, so we have several diuretics. We have four groups of diuretics. We have the loop diuretics, the thiazide diuretics, the um um we have the loop diuretics, the thiazide diuretics, we have the osmotic diuretics, and then we have potassium sparing diuretics, right? So yes, for the loop diuretics we have furosemide, we have bumetanide, we have tosemide. Those are examples of loop diuretics. Okay, then for the thiazide diuretics we have, and when you are talking about loop diuretics, know that they wash away everything, they don't spare any electrolytes. So anybody who is taking loop diuretics, you have to monitor for electrolyte imbalance. You have to maintain intake and output. Okay, tell them to report any form of dizziness so that you can, and you teach them to prevent orthostatic hypotension, because when the body is releasing a lot of fluid and the blood pressure is reducing, there's a risk factor for orthostatic hypotension. So they should rise up from a lying position slowly, okay. And then another important thing is that a patient who is taking loop diuretic, especially furosemide, they should report any rash if they notice any rash, because furosemide is a sulfur agent. Okay, it's a sulfur drug, so the patient is at risk for Steven Johnson syndrome, right? So tell the patient to report any rash. That could be a sign of a reaction or an allergic reaction, so that it can be managed on time. And then for loop diuretic like furosemide again, ototoxicity, furosemide can cause ototoxicity. So when it is administered IV, it should be given slowly to prevent orthostatic hypotension, right? Should be given slowly to prevent ototoxicity. So patients should report tinnitus or ringing in the ear. You should report tinnitus, you should report ringing in the ear. Very, very important. Okay. Then another important thing about the furosemide or the loop diuretic is that um you monitor intake and output, you monitor electrolyte imbalance, you monitor them to report cramps. They're having muscle cramps. That could be a sign of hyperkalemia or hypokalemia. Okay, muscle weakness, muscle cramps. Okay, those are signs of potassium imbalance. Okay, so they should report. Okay, then talking about the thiazide diuretics, they can, they push out or they waste other electrolytes apart from calcium. So you monitor the patient electrolyte imbalance and fluid intake and output too. Okay, then for furosemide, what I didn't mention was that in furosemide, because they waste a lot of electrolyte, patients should eat food that contain potassium. They should eat potassium rich food. What are potassium rich food? Avocado, tomato, plantain, bananas. Okay, these are foods that are rich in potassium. All right, then let's talk about the potassium sparing diuretics. For the potassium sparing diuretics, these ones they waste others and they preserve potassium. So when a patient is on potassium sparing diuretic, you still have to monitor their potassium levels. You monitor their potassium levels, very, very important. Monitor their potassium level, making sure that they are not having hyperkalemia, making sure they are not having hyperkalemia. So they should report signs of a muscle weakness or muscle cramps. Okay. Then another important thing is that EKG should be done regularly so that they can pick any sign of electrolyte imbalance. Okay. Then examples of potassium sparing diuretics, I use the acronym SAME, which is S for spironolactone, A for amiloride, M for mylrenone, E for espirinon. Okay, for the Nclex exam, it's important for us to know these examples in case they are testing you on diuretics, potassium sparing diuretics, so that you can know in case they didn't give you the popular spironolactone. Okay, all right. Then the osmotic diuretics are used mostly for cerebral edema. Okay, osmotic diuretics like the mannitol. Okay, you still do all these precaution, monitor everything, monitor electrolyte imbalance as well. Okay, and watch out for signs of brain herniation. Okay, because when you over remove this fluid, okay, the brain may herniate, so it is giving slowly so that there is no brain herniation. So you watch out for signs of brain herniation when this patient, when any irritability, any deterioration in the GCS, the Glasgow Coma Scale. Okay, and then the patient response, like the Cushing's triad, you have to monitor for all of that. Okay, Cushing's triad, we know um we have hypertension, bradycardia, respiratory imbalance, that is respiratory, altered respiratory pattern. Okay, that's the Cushing's triad. Okay, and then other signs of cerebral edema. Okay, where you have something like the vomiting. Okay, and then dropping or deterioration in the GCS, the level of consciousness. All right, thank you very much for watching. See you in my next video. Please hit the subscribe button. Please hit the subscribe button as you listen to this video. See you in my next video. The next video will be talking more about another class of antihypertensive too. All right, thank you very much. Bye.